So fecal calprotectin test. This is the new one. We're actually seeing that. I've seen that a lot being used, especially in the past 6 years or so. And we've grown to be more and more sensitive. And more available, I'm sure, as well for a lot of patients. So talk about that, the biology behind it, what exactly is calprotectin, and what do we test here, and then we'll talk about how we use it.
So calprotectin, without getting into too much in-depth details, is a protein that is found mostly in neutrophils, which are kind of inflammatory cells that we all have in our body. And inflammatory, not in the sense that they are bad necessarily, in the sense that they are able to start an inflammation that sometimes is good for our body, such as when we fight an infection. So neutrophils is our first line of defense. But when they go into an inappropriate response, then they are part of autoimmunity, such as a case sometimes with IBD. So these neutrophils disintegrate in the gut during the inflammatory activity of IBD. Then the proteins spills out of the cells into the feces, into the lumen of the gut, into the intestine, and then we can measure it in the stool because it comes out and with the protein intact. So this has been a revolutionary, I think, in our ability to monitor Crohn's disease and ulcerative colitis patients since the last 10 to 15 years since it was incepted. It can be affected by other inflammations of the gut, such as infections. So if you've got a high calprotectin, doesn't mean that you don't have a bug. So always test for stool bacteria and parasites, etc. But it is not influenced if one has sinusitis, if one has a flu. So in that sense, it's very helpful for us. If you get an elevated calprotectin, by and large, it indicates that we really have to look into the situation of IBD.